So let's continue our journey with the ocular adnexa by discussing the anatomy of the lacrimal system. So what is the lacrimal system and what are the components of the lacrimal system? The lacrimal apparatus is consist of a secretory portion which is responsible for secretion of tears and the excretory portion which is responsible for drainage of tears. The secretory portion, which consists of accessory lacrimal glands, which we have just discussed for a while, and the main lacrimal gland. And the excretory portion is made of the puncti and the canaliculi, the lacrimal sac, and finally the nasolacrimal duct. So let's have check this nice video that will summarize the details and the function of the lacrimal system. So we have here the main lacrimal gland that secrete the tears over the conjunctival sac, and the tear passes through the inferior lid margin to reach the puncti and the canaliculi and the common canaliculus to the lacrimal sac, nasolacrimal duct, and finally to be the tears emerge from the nose just below the inferior turbinate through a valve of Hasner. So let's again see the video. This is the lacrimal gland, and this is the secretory portion, and this is the excretory portion made of the puncti, canaliculi, superior and inferior, common canaliculus, lacrimal sac, nasolacrimal duct that open just below the inferior turbinate at a valve and guarded by valve of Hasner. So these are the components of lacrimal system. Let's have a closer look to these components. First of all, the main lacrimal gland. So this is the main lacrimal gland. It's about 20 per 12 and 5 millimeters. So these are the dimensions of the lacrimal gland. It has a weight of 75 gram and divided by the levator aponeurosis into orbital part and palpebral part. So this is the orbital part or orbital lobe of lacrimal gland, and this is the palpebral lobe of lacrimal gland, and here is the aponeurosis of the levator dividing this gland into these two parts. Lacrimal gland into inside the orbital cavity or in the floor, and the palpebral part or palpebral lobe related to the eyelid. Again, this is another section showing that this is the levator aponeurosis that divides the lacrimal gland into the outer part or the orbital part and the inner part or palpebral part. You can see the slides. Please tell me in the chat box if you cannot see the slides. Can anyone see the slide? Okay, so Dr. Noha, you have a problem at your side. So the lacrimal glands open by ducts from the orbital part into the palpebral part, and the palpebral part will open by ducts into the superior fornix. So we have about 3 to 5 ducts passing from the orbital part to the palpebral part, and we have more number of ducts passing from the palpebral part to open into the superior conjunctiva. And from your opinion, by knowing these anatomical facts, which part of them which will be more important? The orbital part or the palpebral part? Can you answer me in the chat box? Which part is more important? The answer is the palpebral part. This is the most important. Why? Because if we removed the orbital part, the patient can still have functioning lacrimal gland through the palpebral part, as the palpebral part will continue to secrete its the tear film or the aqueous secretion into the conjunctiva. However, if we removed the palpebral part, then the connection between the orbital part and the palpebral conjunctiva will be lost. So the orbital part, although it is present, but it will not be functioning, and it will not be useful. The structure of the lacrimal gland is made by acini. These acini are arranged around the central duct, and this duct will open into excretory duct that will finally open into the superior conjunctiva. Blood supply of the lacrimal gland comes mainly from the lacrimal artery, which is passing above or running above the superior border of the lateral rectus until it reaches the lacrimal gland and drained by the lacrimal vein. Lymphatic supply, since that the lacrimal gland is present laterally, so it will drain into the preauricular lymph nodes. And the function of the lacrimal gland is to secrete the tears, mainly the reflex secretion, causing moistening of the eye and prevent friction of the globe to the lid by lubricating the eye and keeping the corneal transparency. The most important thing in the lacrimal gland is the nerve supply. So the nerve supply of lacrimal gland come mainly from has three nerve supply: sensory, sympathetic, and the parasympathetic. So let's first check the parasympathetic. So where does this the parasympathetic nerve supply to lacrimal gland come from? The center for tear secretion is the superior salivatory nucleus. This is one of the nuclei of the facial nerve that is present in the floor of the fourth ventricle. This nucleus will give the nervous intermedius, in which the preganglionic fibers will pass with the nervous intermedius until it reaches the geniculate ganglion. The geniculate ganglion is not the ganglion for the preganglionic fibers of the parasympathetic of the seventh nerve, so it will not relay, but it will continue as a greater superficial petrosal nerve. So let's see here. This is the center. Superior salivatory nucleus will give the nervous intermedius, or the preganglionic fibers will pass with the nervous intermedius that pass through the geniculate ganglion, but it will not relay in the geniculate ganglion, but it will pass to the greater petrosal nerve, or the preganglionic fibers will pass with the greater petrosal nerve. Then from the greater petrosal nerve or greater superficial petrosal nerve, the nerve supply or the preganglionic fiber will pass with the nerve of pterygoid canal or Vidian nerve. This nerve passes through the pterygoid canal. Then after it emerges from the pterygoid canal, it will reach the sphenopalatine ganglion, which is the ganglion for this nerve. So it will relay in the sphenopalatine ganglion, and the fibers will emerge from the sphenopalatine ganglion as postganglionic nerves. The postganglionic nerve will pass with them, will join the maxillary nerve from the, and then it will leave the maxillary nerve to join the zygomaticotemporal nerve, and then it will leave the zygomaticotemporal nerve to join the lacrimal nerve until it reaches the lacrimal gland. So here is the journey of the nerve supply of parasympathetic pathway of lacrimal gland. So let's repeat it again. From the greater superficial petrosal nerve, the preganglionic fibers or the preganglionic parasympathetic fibers will continue with the greater superficial petrosal nerve until it is joined by the deep petrosal nerve, as both of them together will form the nerve of pterygoid canal or the Vidian nerve. Then after it emerges from the pterygoid canal, it will reach the sphenopalatine ganglion, and this is its station. So it will relay here, and the postganglionic fibers will emerge from the sphenopalatine ganglion to reach or to join the maxillary nerve. Then it will leave the maxillary nerve to reach the zygomaticotemporal nerve, and finally it will reach the lacrimal nerve to supply the lacrimal gland. So this is the pathway of the parasympathetic to the lacrimal gland. The sympathetic pathway, on the other hand, will emerge from the superior cervical ganglion. So the superior cervical sympathetic ganglion, it is the sympathetic ganglion that will give the postganglionic fibers that will supply all the sympathetic supply to the eye. The postganglionic sympathetic fiber will join the internal carotid artery. Then it will join the deep petrosal nerve, and from deep petrosal nerve, it will join the nerve pterygoid canal and then to the sphenopalatine ganglion. But here is the trick. It will not relay in the sphenopalatine ganglion because this is a parasympathetic ganglion, not a sympathetic ganglion. So it will leave the sphenopalatine ganglion without relay, then it will join the postganglionic sympathetic fibers that will join the maxillary nerve, then join the zygomaticotemporal nerve, then it will join the lacrimal nerve, and finally the lacrimal gland. So you can see that this pathway, it is more or less a common pathway between the sympathetic and the parasympathetic. The only difference is that in the sympathetic, it joined the deep petrosal, while in the parasympathetic, it joined the superficial petrosal. The other difference is that in the parasympathetic, the nerve will relay in the sphenopalatine ganglion, while in the sympathetic, it doesn't relay. So the sympathetic fibers will, from the sympathetic plexus, coming from the superior cervical sympathetic ganglion, will join the internal carotid artery, then the deep petrosal nerve, then the nerve pterygoid canal, then pass with the pterygopalatine ganglion, but without relay, to join the maxillary nerve, then it will join the zygomaticotemporal nerve and the lacrimal nerve, and finally the lacrimal gland. The sensory for lacrimal gland is coming also from the lacrimal nerve. So this is all we need to know about the lacrimal gland. So this is the secretory portion. Let's now discuss the excretory portion, or the drainage system. The drainage system is the first gate of the drainage system will be the pancreas. We have upper and lower pancreas. So this is the lower pancreas, and here is the upper pancreas. The pancreas are slightly elevated, rounded or oval opening, as you can see here. It has a diameter of 0.3 millimeters, and they are situated between the at the junction between the lacrimal portion and the ciliary portion of the lid margin. The difference or the distance between the punctum is different according it is upper or lower. For example, the upper punctum, it is only 6 millimeter from the medial canthus. However, the lower punctum is slightly more far, so it is about 6.5 millimeter from the medial punctum, medial canthus. The medial or the pancreas are inverted into the lacrimal canal or lacrimal lake when the lids are closed. So when we are closing our lids, the pancreas will drain all the fluid or the lacrimal fluid present into the lacus lacrimalis. So this occurs because they are inverted during closure of the lids. And they are surrounded by a relatively vascular connective tissue that keeps this pancreas open and doesn't collapse. And this is what makes the whitish color of the pancreas. And also the orbicularis oculi, as we mentioned, are helping the tube drainage by its pars lacrimalis. Here are the orbicularis oculi, the lacrimal part, surrounding the canaliculi and the pancreas. And by this part, the lacrimal pump mechanism act and they help in the tear drainage. Then the pancreas will continue as canaliculi. The canaliculi are divided into vertical part and horizontal part. The vertical part is about 2 millimeters, while the horizontal canaliculi is about 8 millimeters. Both of them join together to form the common canaliculus, or to form a common canal, which is called the common canaliculus. And this common canaliculus show dilatation. It's called the lacrimal sinus of Meyer. So the lacrimal sinus of Meyer, it is the joining of the both canaliculi together at the area of lacrimal sac. This lacrimal sac of Meyer open into the lacrimal sac through an opening. This opening is guarded by a valve called the valve of Rosenmuller. So don't confuse the names. Lacrimal sinus of Meyer, it is the junction of the upper canaliculus and lower canaliculus into the common canaliculus, while the valve of Rosenmuller, it is the valve which is between the common canaliculus and lacrimal sac. The diameter of the canaliculi is about 0.5 millimeters, and they present at the lacrimal portion of the lid margin. They are lined by stratified squamous epithelium and surrounded by the Horner muscle or the pars lacrimalis of the orbicularis oculi muscle, which will help with the tear drainage. This is all what we need to know about the canaliculi. The lacrimal sac, it is present into the lacrimal fossa, and this has been discussed in the orbital lecture. So we said that the lacrimal fossa, the anterior part of or anterior lacrimal crest, is formed by the frontal process of maxilla, while the posterior lacrimal crest, it is made by the lacrimal bone. The lacrimal sac occupies the lacrimal fossa, which is situated between the anterior and the posterior lacrimal crest. It has dimensions of 15 to 5 millimeters when distended, and consists of three main parts: the fundus, which is above the medial palpebral ligament, and the body behind the medial palpebral ligament, and the neck, which is below the medial palpebral ligament and continuous with the nasolacrimal sac. So the lacrimal sinus of Meyer, it is present here. And the canaliculi opens into it, as we said. It consists, or the sac is covered by two layers of columnar epithelium and surrounded by lacrimal fascia. So we said that the lacrimal fascia is enclosing the lacrimal sac, and this fascia is formed by splitting of the periorbita. So it will be formed by the splitting of the orbital fascia into two layers that is attached at the posterior lacrimal crest and enclose the sac and meet again they meet again at the anterior lacrimal crest. So what are the relations of lacrimal sac? Medially to the lacrimal sac, we have the lacrimal bone, as you can see here. And this lacrimal bone will separate the lacrimal sac from the ethmoidal sinus and the middle meatus of the nose. Lateral to the sac, it will be the skin and orbicularis oculi and lacrimal fascia. Posterior to the sac, as you can see here, there will be lacrimal fascia that enclose the sac. There will be the Horner muscle, and behind the Horner muscle, there will be the orbital septum and medial check ligament of medial rectus. While anterior to the sac, there will be the angular vein, which has a very important relation to the sac, and as we will say in the applied anatomy. And in front of the sac, there will be the medial palpebral ligament, as we said earlier. The blood supply of lacrimal sac is coming from the dorsal nasal artery, and the applied anatomy of the lacrimal sac that the lacrimal sac is attached to the lacrimal fascia. So if someone is hit in the eye, this fascia may cause tearing of the lacrimal sac. The pulling of the medial palpebral ligament will pull on the sac, causing a tear. So if the patient blow his nose, this will lead to passage of the air into the sac and under the skin of the eyelid. So it will lead to what's called surgical emphysema. Also, that the another importance is that in the lower border there is less resistance to distension. So most of the swellings, as we saw earlier of the acute decrecistitis, most of the swellings usually make a swelling in the area below the medial palpebral ligament. Other importance here is that there is an important vein related to the sac. It is called the angular vein. So the angular vein is formed by the union of the supratrochlear nerve and the supraorbital nerve. and they continue then they will continue later on as the facial vein. So the importance that this angular vein formed here, this is the lacrimal, this is the canaliculi, this is the common canaliculus, and this is the sac, and this is the nasolacrimal duct. Here is the medial palpebral ligament, and here is the angular vein. So the angular vein in close relation to the lacrimal sac. It is located or it crosses the medial palpebral ligament about 8 millimeters from the canthus. So if we when we are doing the DCR surgery or the dacrocystorhinostomy surgery, we need to incise the sac. So in order to incise the sac, we need to have good exposure. Sometimes if we are not aware about this, the presence of angular vein here, then we may by mistake injure this vein, causing severe bleeding. That's why, for better exposure to the sac and avoid the risk of damage to the angular vein, we either open the sac just 6 millimeters from the medial canthus or 10 millimeters from the medial canthus. That's how we can avoid injury to the angular vein. Finally, or the final part of the lacrimal apparatus is the nasolacrimal duct. So the nasolacrimal duct, it is a downward extension of the nasolacrimal sac till the inferior meatus. So the nasolacrimal duct will open into the inferior meatus, which is below the inferior turbinate of the nose, and it is guarded by valve of Hasner. So don't confuse the valve of Hasner of the opening of nasolacrimal duct and the valve of Rosenmuller between the common canaliculus and the lacrimal sac. It opens at the lateral nasal wall, lateral and below to the inferior turbinate. The length of the nasolacrimal duct is about 15 to 18 millimeters, and there are 3 main bones that share information of the nasolacrimal duct. And this, again, one of the most common areas of questions. These bones are the maxillary bone and the lacrimal bone and the lacrimal process of inferior concha. So here, the inferior process of the or the lacrimal process of the inferior concha and the lacrimal bone here and the maxillary bone. All these 3 bones share in the formation of the nasolacrimal duct or nasolacrimal canal. The direction of the nasolacrimal canal is downward, lateral, and posterior. And so if we can draw a line joining the medial canthus to the upper first molar tooth, then this line will be coincidental with the nasolacrimal duct. The nasolacrimal sac or the nasolacrimal duct itself has numerous valves, but they are not valvular in action. This is again asked in the MCQ before. So there are several valves throughout the course of nasolacrimal duct, but they are not valvular in action. The only valve that is valvular in action is the valve that guards the end of the nasolacrimal duct, which is called the valve of Hasner. So this valve will prevent the sudden gush of air during blowing the nose. This is the function of the valve of Hasner. So what are the relations of the nasolacrimal duct? Lateral to the nasolacrimal duct will be the maxillary sinus, while medially it will be the middle meatus of the nose, and this is the middle turbinate. So the middle meatus of the nose located medially, while the nasolacrimal duct open into the inferior meatus. So just put this in your mind, because again it was asked before in the exams. The nasolacrimal duct open into the inferior meatus. Where does the nasolacrimal duct bring its blood supply? This comes from the medial palpebral artery, angular artery, and the infraorbital artery. Here is the infraorbital artery. Here are the medial palpebral artery and the angular artery. So here is the angular artery. The venous also come from the angular vein and the infraorbital vein and nasal veins. So this is the blood supply. And the lymphatic supply, since that it is the nasolacrimal duct, it's present medially, it will drain its lymphatic supply into the medial group, which drain into the submandibular lymph nodes. And the nerve supply, it is supplied by the infratrochlear nerve, which is a branch from the ophthalmic nerve, and it receives another nerve from the axillary nerve, which is called the anterior superior alveolar nerve. So this is the end of the lacrimal system and the ocular adnexal.